The past two topics have been pretty intensive for some of you, but I know you will see the benefit of your work in future modules. This week will be a bit less intense as we skip ahead in the book to Chapter 13 to round out this module by learning about health psychology in the healthcare setting and focusing on ethical issues with research in clinical populations. So here's a reminder of the list of readings and assignments for this week. As always, you have a reading from the textbook, Chapter 13. I estimate this should take you about an hour to read carefully. I've also found a brief article that was presented to the American Psychological Association as a call for what health psychology is in the modern world. It is written by a professor from Florida State. I provided a worksheet to help guide you as you read. I found a video to help you consider ethics in health psychology. It is a video describing the experiences of Henrietta Lacks and her family that is a great example for considering ethics and health disparities. I've also provided you a quick video on the Belmont Report, which guides current research in human subjects. There's some supplementary resources to help you understand what health psychologists do, and even 4 videos from 4 local health psychologists specifically saying how they apply health psychology in their work. You have a health profile this week where you can choose from one of 2 prompts. You only need to complete one of these prompts. This week's health profile requires peer comments, so be sure you go in by Saturday at 5 p.m. and post on 2 of your peer posts with insightful comments that elaborate on the material. You have a quiz due on Friday by 5 as well. I hope you've been keeping up on your module assignment, which is also due this Saturday by 5 p.m. As a reminder, if you want my approval on the community organization you choose for this assignment, you can send me an email with their name and a link to their website, so I can give you my advice if they'd be good to evaluate using what we've learned so far in Module 1. So let's get started. Learning Objective 1 of this week is to be able to recognize and explain key terminology relevant to health psychologists in the healthcare setting and ethics. This will help you in the second learning module to list ways health psychologists contribute to research and clinical practice in the healthcare setting and medical field. Between the supplementary reading, textbooks, videos, and website, you will get introduced to a variety of ways that we see health psychologists in the healthcare system, like helping with patient adherence, pain management, or even helping patients prepare for hospital procedures and being more assertive in communicating their needs. I hope this helps you better see how this course could assist you in your career aspirations. There are startling statistics on medical care challenges that health psychologists may be able to alleviate. For example, approximately half of all causes of morbidity and mortality in the U.S. are linked to behavioral and social factors. Moreover, in a study of patient communication, doctors interrupted patients' descriptions of their illness within 18 seconds. Finally, only 3 out of every 4 patients follow their treatment regimens closely. That means that 25% of patients don't follow the advice of medical professionals. For those of you looking to enter a medical profession, ask yourself these questions as you read the textbook and go through the learning activities for this topic. For example, what can you do to increase patient adherence to treatment? How common is patient non-adherence? And what can lead to delayed behavior in seeking treatment? In a medical profession, you will get lots of training on how to help cure physical illnesses, but what good does it do if you can't connect with your patients, know how to ask the right questions, and understand the barriers and promoters to following your advice? I've included supplementary material covering ethics in research on human subjects. This satisfies your third learning objective, to recognize examples of ethical and unethical practices in research on health and well-being. We strive for evidence-based practice in health psychology, which means we want our approaches to be grounded in science. Therefore, whether you will be applying health psychology in research or practice, you need to understand ethical considerations. You will learn about the Belmont Report, which outlined important consideration and standards when conducting research on human subjects. We are guided by 3 principles: beneficence, which means keeping participants' best interests in mind; respect for persons, where people have the choice to engage or not engage in research; and justice, where the burden of medical research should be equally distributed among a population. Certain people should not be the focus, like vulnerable populations or samples of convenience. These are best served when we are sensitive to where people are developmentally, how they are influenced by their culture, and what their values are. The third video I provided will elaborate more on the Belmont Report, and then you will see an example of how this was not practiced with the story of Henrietta Lacks. The Belmont Report was put together due to unethical treatment of human subjects, like what was conducted during World War II by the Nazis and the Tuskegee and Guatemalan studies which aimed to help health but exploited vulnerable populations. After going through this material, you are ready to demonstrate your mastery of it with your health profile. For your health profile this week, you have two options. If you know you're interested in health and health-related career, you may want to answer, how do you see health psychology assisting you in your career development? Discuss how you will either use it directly in clinical care or indirectly in other manners. To answer this, pull in what you've learned from Chapter 13 and from the supplemental materials I provided. Be sure you are showing evidence of drawing from multiple resources in answering your health profiles. However, you may be very interested in the case study I provided you for this week on ethics. If so, you can answer the following. Henrietta signed a consent form that said, I hereby give consent to the staff of the Johns Hopkins Hospital to perform any operative procedure and under any anesthetic care, local or general, that they may deem necessary in the proper surgical care and treatment. Based on this statement, do you believe Johns Hopkins had the right to obtain a sample from her cervix to use in their research? What information would they have had to give for Henrietta to have given informed consent? Do you think Henrietta would have given explicit consent to have her tissue samples used in medical research? Do you always read consent forms yourself before signing them? As always, remember to check the rubrics before you turn in your health profile to be sure you're optimizing your chances for full credit. Don't forget your module assignment, where you need to identify one prevention program in the community that you believe is based upon theory and research relevant to health psychology. After this week, you will have everything you need to complete the worksheet for this assignment. Check out the rubric to make sure you're answering everything completely and correctly. I'll be making your groups for your group projects based on people identifying the same or similar programs. After this week, you're through with Module 1. Congrats! I hope you feel like you have a nice foundation in what health psychology is about and are ready to start applying this understanding to topics like stress, coping, and health behavior change.